So, with this, ladies and gentlemen, as we go further,
Yes, we move forward, and now it's time to shift our focus to the broader national and global perspective shaping healthcare in years ahead. And now I would like to invite Mr. Aryaman Tandon, co-founder and managing partner, Praxis Global Alliance, to present the inaugural keynote address and to start this discussion. Can we have you on stage, please, sir?
welcome, sir.
Morning, everyone. Dear guests, all the award nominees, on behalf of the VOH team and all the sponsors, extend you an extremely warm welcome to this very pivotal event, I must say. This is a great initiative, very first of an entire series, which I'm very confident will create massive transformation for leaders in this ecosystem. I want to start and kick off the event by talking about why this is so critical and why healthcare is such a transformational space for India, and why I strongly believe that we are only tapping the surface right now of what massive opportunity this ecosystem will create in the next couple of years. Welcome everyone, and look forward to this exciting day today. To start off with, I want to put some statistics, and this is what we all consultants do the best. Today, healthcare stands at almost a $300 billion ecosystem if you add up all the components, of the overall pie, which is massive, which is almost 10%, of a very large sum of the overall GDP. However, if we go and look 5 years down the line, in terms of per capita spending, we are still abysmally low compared to all other countries. We are very low at the bottom. And because of that, which is a massive tailwind of economic growth, we will continue on a 15 to 20% growth trajectory and be almost a 700 billion ecosystem in the next 5 years. So good thing is we don't need to do anything for that. This will naturally happen. But here is where I want to push the boundaries a bit. The government targets India to be the third largest GDP by 2030, but 700 billion will only make us the fifth or the sixth largest healthcare ecosystem in the world. So why can't we be the third largest healthcare ecosystem in the world as well? We have the largest population and we have one of the largest need for health. Why can't we do it? Which is where I want to spend time today. I think the existing tailwinds, which I spoke about, will naturally take us to a $700 billion ecosystem. There is a massive need for health. We've already created exemplar cost-efficient care models, which is globally very cost competitive, despite and at a good quality. Government in the last 3 to 5 years has really ramped up their focus, so they are giving health the necessary importance. We have embarked on a massive digitization journey with ABDM and a lot of other private innovators in the digital space. And then we've also started localizing. Pharma was a big chunk of it localized, but even medtech, we've started localization. So we're creating a local infrastructure. This will help us grow at a 15-20% growth rate. But if you really want to push the envelope and be a $1 trillion economy, we need to address some of the headwinds, which is structurally stopping us to truly unlock the full potential. And there are some 5 or 6 very key things, and which I see as opportunities rather than headwinds, because if we are able to change this, we can truly create a massive ecosystem. One is fragmentation, and we'll talk about these. Other is insurance coverage. We are still very low penetration in insurance. A lot of other countries have massively and very rapidly reached 100% in universal coverage. Preventive care, we still focus on caring for the sick, but we don't focus on keeping people healthy and preventive care. A massive, lopsided focus. Quality of outcomes. While some of the leading corporate chains and private organized providers have delivered good quality, but vast majority of the infrastructure is still non-accredited and needs to rapidly and transformationally improve their quality. And finally, financing. We are very, very short of infrastructure across labor, across manpower, skilled, unskilled, across provider ecosystem, equipment, local manufacturing, education. So we need to make massive investments in infrastructure creation, which is why we also need to make healthcare a lucrative option for investors, from equity to debt financing to other innovative ways of raising capital. So we'll focus on some of these points today. I'll move through some of the tailwinds, very quickly. Some interesting statistics. India represents almost 20% of global disease burden, if you look at NCDs or CDs, but we only represent 1% of the spending. This is truly unbelievable. 20% of the burden, but 1% of the expenditure, which shows how massive the opportunity for us is to scale healthcare. We have, over time, demonstrated that we can deliver very high quality care at extremely cost competitive prices. If you look at the right side, these are prices for a lot of procedures, and we're even lower than a lot of other countries which are lower than per capita income for us in terms of procedure prices. We rank third on cost by MTI. We rank sixth on quality, which shows that this cost efficient model is not at the cost of quality. Government, like I mentioned, as a role as a peer, as a provider, to drive localization, make in India, to digitization, has created some really transformative regulations and initiatives and incentive structures to enable this. So we thank the government for now actually starting to give importance to this sector. A lot more needs to be done, though. We have embarked on a massive digitization journey, from adoption, utilization, public sector role, but we've only started on this journey, and a lot of potential still needs to be unleashed through the use of EHRs and data. Finally, we've also started localization from manufacturing, from infrastructure, creation of medical device parks, regulations, everything that enables localization. We've embarked on that journey, but still, again, lots to be done. Now, talking about what's the critical game changers for the next 5 years, the 5 things which we spoke about. Number one, fragmentation. We are extremely fragmented if you look at the provider ecosystem on the left, or the demand on the top right, where metro, tier 2, tier 3, tier 4, all of them are completely different healthcare markets with very different nature of demand and size. So we have an Indonesia, we have a Brazil, we have a Nigeria, we have all sorts of countries sitting within $1 $3 trillion economy. Then on the insurance, by the way, even financing, where you have state schemes, you have central schemes, you have voluntary private insurers, it's extremely fragmented in terms of financiers. And finally, on the regulator side, you have state regulations, you have central bodies, then all the states have their separate bodies for drugs, etc. So the regulatory landscape is also extremely fragmented. And which is what demonstrates in scale of providers that we have created so far. I mean, of course, Apollo, Max, Fortis, and some of the leading chains have created a lot of supply, have created some amount of scale, but they're truly tapping only the surface right now. The largest players in India are only 2% market share, $3 billion. If you look at US, greater than $100 billion, right, in terms of market share, in terms of size, sorry. In Germany, in Australia, in Saudi Arabia, etc., players have gained almost 6 to 7% market share. But the largest chain in India is still about 10,000 beds only, which shows that very little scale has been created against the true potential of providers. Insurance, so we are only about 25% penetrated in insurance coverage. Rest of it is covered via government schemes. Even countries like Indonesia, Colombia have reached universal coverage and 100% insurance. We are way behind in this. A lot of innovation needs to still happen on insurance. And if I talk about insurance, another very critical thing is, if you look at most of the countries, similar GDP per capita or above us, and if you look at the red bucket, majority of the healthcare spending comes from a mandatory form of insurance mechanism. We do not have any mandatory form of insurance. We have been grappling with the problem of missing middle since about 10 years now. And they have proven that they do not want to adopt voluntary insurance. Even the private insurance, the scale-up has happened in the group policies, and the individual policies have really plateaued as of now, which basically shows that a massive supply of capital is completely missing because we do not have a mandatory universal healthcare mechanism. This is the right time we should be thinking about universal coverage. Primary care, this is the other theme. We have one of the lowest consultation rates and testing rates across a lot of other developed and developing countries. We only do about 2 consults per year per person and 2 tests per person per year. Even the spend on primary care per capita is abysmally low, even lower, by the way, than some countries, lower than per capita income for us, which shows that the focus is extremely skewed towards sickness and not wellness. And again and again, a lot of global models like Geisinger, Claret, Kaiser have shown that adoption of primary care really improves health outcomes and also cost of care gets reduced. So we need to start thinking about preventive wellness and wellness overall in health rather than sickness. In terms of quality, while the corporate providers and some of the accredited hospitals have demonstrated and led the baton to drive quality care, bulk of the supply, of providers still is abysmally behind in the quality curve in terms of everything around hospital-acquired infections, AEMT, etc. We are way behind compared to a lot of other countries. If we talk about accreditation, less than 6%, only about 3% of hospitals are fully accredited. If you look at countries like Philippines, Indonesia, Thailand, majority of the hospitals are accredited. And these countries are very, very little ahead of us in terms of per capita income. And by the way, even our accreditation rate is fairly sophisticated. So I think it's also important to think about whether we need to create leaner structures for accreditation and driving quality. Finally, the last point, infrastructure creation. Very short on supply of medical workforce, doctors, nurses, hospitals, and even equipment, critical medical equipment. Majority of it, if you see on the right side, is still imported. And this is where bulk of the capex, for the provider ecosystem goes. We need to, and by the way, the supply of this infrastructure is also massively skewed, where metros today have almost a problem of plenty, but tier 2, tier 3, tier 4 cities are abysmally low in terms of supply. So this infrastructure creation also needs to convert some of these deeper pockets to having abundant supply. With this, and this is why the event today is so critical. I think all the categories that VUH cover in this award ceremony are very critical and pivotal enablers to really driving this transformation and unlocking this growth. With this, I want to extend a warm welcome once again to all of you and look forward, and thanks for everyone for making to this. Thank you so much.